Okay.
Or Larry.
All right. Welcome, everyone. Hope you all had a great summer. It's been a while since I've been here. We didn't meet in August. And I wasn't here in June and July, so I feel like I have a lot of catching up to do. But we'll go ahead and get started with introductions. We have a lot of guests here today, so we'll have everyone introduce themselves as we go around. I'll start with the folks on Zoom. How about Harmony?
Thanks, Lisa. I'm Harmony Ayers Friedlander, Deputy Commissioner for Mental Health, Director of Community Services.
Hey, Salimar.
Yes, good afternoon. My name is Sulimar Pina Vasquez. I work Human Resources at Cornell, and I'm here as a community member.
Kathy?
Hi, I'm Khaki Wunderlich. I'm a former member of the board who is interested in coming back and rejoining the board. So I've come back to hang out at a meeting with you and say hi.
Very nice to see you. Larry?
I'm Larry Roberts. I'm a member of the Community Services Board and the chair of the Mental Health Subcommittee. And Harmony, what are you doing here?
I injured myself, Larry, and had to come back, but I read the book you recommended while I was injured. I hurt my knee. So luckily, Larry gave me a good book to read.
Good. All right, Frank. Frank?
Yes, I am Frank Group and I am the commissioner.
Sheila McHenry, member.
Stu Bergman, member of the board.
Mary Hutchins, member of the board.
Do our role of guests here.
Everyone, I'm Nicole Zulu. I am Director of Health Planning at Human Service Coalition. I serve as the Director of the Tompkins Health Planning Council.
I'm Howard Reed, and I'm interested in being a member of the board.
Hi, good afternoon. I'm Dr. Anna Tamas. I'm a clinical psychologist here in town who works with families, children, and teens.
Oh, I'm Elise Schweitzer. I'm the chair of the board.
I'm Debbie Barber, Tompkins County Sheriff's Deputy and member of the CARE team.
Rachel Webb, social worker here at Mental Health, but also part of the CARE team.
Sally McConnell-Janae, member of the Community Services Board.
Randy Brown, I'm a member of Tompkins County Legislature. Travis Winter, board member.
Jessica Connor, board member and mental health subcommittee member. Great, thank you very much. Does anyone have any additions or deletions to the agenda? All righty, hearing none. Is everyone ready to approve the minutes?
We can't,
We can't, we don't have a quorum?
we're one short.
Okay. All right, so we'll table the minutes until the October meeting.
Hopeful someone else will arrive because we have some other voting to do at the very end in executive session.
Yeah, and didn't Jan say that she wasn't going to be able to make it tonight?
Not in person, right?
Okay.
Correct.
Yeah.
So Auguste, Dr. Devon could help us.
He's in town, so hopefully he'll show.
I didn't know who's coming that hasn't arrived yet.
I don't know who else we're blanking.
Well,
But we'll see what happens.
Stacked.
Okay. Okay, privilege of the floor. Any questions or comments from board members or guests? No? Okay. Any correspondence or announcements? Oh, all right. So, go ahead and get started then. I feel like I welcomed you all, and this is welcome on the agenda, and that tripped me up a little bit. Welcome. Do I need to give a speech now? So Frank, why don't we go ahead with your reports?
Sure. So I was fortunate enough to be able to have a fairly long vacation at the end of August. And so I'm just now getting my feet back under me this week. But probably the biggest thing happening for us in this time frame is the county budget. So we have submitted our proposal to the county administrator. I believe she's presenting that to the legislature next week. And then they'll be considering that. We were given a maintenance of effort instruction, which is what we did. So we'll be continuing the work that we've been doing, no change to programming or staffing within the department. We did offer 4 OTRs or over target requests, which are for additional funding beyond maintenance of effort. The first one is to continue funding the CARES team for another year. That was when it was approved, was a multi-year approval. So we're hopeful that the legislature will continue to fund that. And then we also put forward an OTR to fund the community outreach worker program that covers the rural parts of the county. So you're probably familiar with the community outreach worker program that focused it on the commons areas in downtown Ithaca. Initially, it was Tammy Baker. It grew to a second position, and now there's some other folks that are doing that, or they're in the process of recruiting. Harmony, with the leadership of Family and Children's, we're able to get 1-year funding from OMH to expand that program to the rest of the county. But it was 1-year funding, and so it's ending. And if we want to continue that, we'll need new funding. They purchased a lot of equipment, a van, computers, those kinds of things. So really the OTR is centered on staffing to be able to continue that. So it'll be up to the legislature to decide if they want to fund that. There are 2 continuing OTRs, the 3rd year of support for the Alcohol and Drug Council. The county had gave them money over 3 years to support the standing up of the facility on Hanshaw Road. So this would be the 3rd year of that. The amount, I believe, is $150,000. And then there is also an OTR for REACH for some nursing support. That was a legislator member filed OTR last year during the budget process. And so we put that forward as a continuation there as well. So those are the 4 OTRs that the legislature will be considering. We are hearing from county admin that the budget is tight. And so all of this is where it stands today. Obviously, once it gets to the legislature, they'll start making decisions based on the information that they have. And we'll report back any updates on those. But that's kind of the budget process as it stands.
Okay. Any questions for Frank? Yeah, go ahead, Jessica.
I've heard some rumblings, at least over on the Tompkins County Youth Services Department, I might be butchering that name, hiring freeze for Tompkins County. And I just was wondering how that's going to impact mental health, substance use, and developmental disability supports.
So the county administrator is working through both the 2023 budget as well as 2024. And as I said, the budget is looking tight. And so one of the tools that county admin normally uses is or can use is a hiring freeze. At least that's how it's described here. Every time we have a vacancy, even when that language isn't being used, we have to get approval to fill from county administration. So it's already kind of happening anyway. So it's not a big change, except for the extent of whether or not positions can be filled. So far, most of actually, I think every position we've asked to fill has been approved. And that's mainly because we generate revenue with most of those positions or their support staff for people that do generate revenue. And so it isn't a real good place to find those savings. So yes, other departments, there may be a more direct impact because they don't necessarily generate revenue. And so it's fully county funded. And if there's a shortfall, they have to make adjustments.
Thank you.
Randy, did you have a response to? Yeah.
I'm on the Youth Services Board. And that's true that there was a position in this year's budget that wasn't filled, and they've been told that it's not going to be filled or not proposed to be filled. I disagree completely with that. In addition, there was funding to Youth Bureau and other things of a 2% increase, which I'm hearing that's not proposed to be included as well, which I'm completely against. And the entire Youth Services Board is pushing to have the budget replaced. I'm in disagreement on the financial situation of the county. I think the county has lots of money. I'm a Republican, so I'm, and I believe in spending money on progressive things. So watch the budget and come and say your piece when that time comes.
Do we have a date for that meeting?
September 19th is going to be, I think that's the Tuesday. That will just be a budget presentation at that point. There won't be a lot of discussion. There'll be a lot of other special budget meetings in the weeks that follow. I think there's at least 3, and they'll go through each individual department. And that's when, and you'll see that schedule. And if you have specific departments you want to talk about, you come in and speak to that. And the legislature needs to hear from people.
Just a question for Randy. The 2 things that you mentioned that the legislature as a whole were opposed, but you supported, was that because of there are other priorities that?
Youth Services Board
Yeah.
unanimously, we're only it's just a board of
Okay.
youth services, not the full legislature. I'm the only legislator on that.
Oh, I see. Okay.
So I'm just one of 14.
Right. And so as you were talking about, you were supporting it on the Youth Services Board.
And I'm going to support, they put OTRs in to replace these things, this person.
Right.
There was a time when there was 6 people in the Youth Services Department and there are 3 now. So cutting youth programming makes no sense to me whatsoever.
Stu, did you have a question?
Yeah, just a curiosity. I didn't hear the REACH OTR being sponsored again by the legislature. What number was that? You have the amount?
The amount. I probably do. Here, just give me 1 second. I'll reach medical. I do not have the number. I want to say it was in the 70,000 range, but I can double check that.
And that's for nursing staff.
Yes, yeah, the mental health department already contracted with REACH, so that's why it got placed with us. Because we were already contracting, we could just add to that. September 26th at 7 p.m. or 7:25 p.m. is when I'm scheduled to present our OTRs. So that's the evening that will be going on, but there'll be others throughout September where youth and other departments and this, schedule gets posted on the county's website. Of who's presenting when as part of the budget process.
Thank you.
And are those meetings streamed?
Yes. Yep. They're all streamed on YouTube.
I have a question for you, Frank, a different subject. Any COVID updates in terms of new vaccines?
Sure. So COVID cases are increasing. The good news is hospitalizations are not. So those have remained stable, which we're hoping means that new variants that are circulating is not going to be there as we've experienced in the past. So that's good news. The vaccine is imminent. I don't know really any more than you do. We're still waiting for the data to be published related to the approvals from the CDC advisory groups and the FDA advisory groups. But my understanding is we're talking weeks, not months at this point. And we'll have more information about when the vaccine might actually be available in the community.
There are flu vaccines available in the community now, and we're working to get RSV vaccinations as well. I was just looking, because September 12th is when some group meets about the COVID vaccine. And then,
ACIP.
yeah, ACIP. And then shipping of the new vaccine should start a few days after the official approval from ACIP.
Assuming they approve it after they review all the data and it looks like
Yes,
it's going to
yeah.
work and all that. Yeah, I think sometimes we get a little ahead of ourselves. There is a review process, and there is a chance they could say no, that we can't do this. Just one other thing, real quick, if you came in the front door, perhaps you saw the little sandwich board that's out there. Genoa is operating Harmony. They're open. Yes. So the pharmacy is open and is beginning to serve patients. Obviously, they're doing kind of a soft opening. After we talked with them about the opening, they said probably 2 or 3 months, they'll do a grand opening where they'll invite folks in and they'll have, some food and drinks and stuff just to make the announcement to the community they're open. But we're really excited about that. They've done a couple presentations to staff, what they're going to be able to do for our clients as far as packaging drugs in ways that are easy to manage is amazing. Their ability to work with the insurance companies around pre-authorizations, particularly for injectable medications. The nurses are just ecstatic. So we're really excited to have them on board and operational. So kudos to Harmony and Jeremy and the many others that worked with Genoa to get that into a reality. So we're super excited about that.
2 questions. One, Jan needs to be let in.
Sorry. Thank you.
2, congratulations on the pharmacy. I know that's been a big lift. Any sense of their likelihood to stay in stock of the stimulant medications that everyone else in town has been really out of, and families are just calling like 8 different pharmacies trying to find their medicine? Maybe I will send them all.
Harmony, do you know anything about that?
No, I do not, but it's something we can check in. I think those are, larger shortages.
They are nationwide shortages, yes.
Yeah, so I'm not sure if they have any better access at those medications than others do, but they are a very large pharmacy chain, so they may very well have that ability. So can find that out.
Okay, yes, a community-wide, it continues to be a problem for families.
Jessica, what medications are we short of?
The stimulant, ADHD medications, so the methylphenidate and Adderall based medications have been, it's a nationwide shortage, and it's really been, families have really had to just call around multiple pharmacies because a pharmacy that'll have it in stock for one day at one dosage doesn't have it the next day, but this other pharmacy does. And I don't know.
Have you checked Mark Cuban's pharmacy online?
Yes, but we've run into some different things with it.
All right, because I
All right, any other questions for Frank before I move us on?
Just this, the answers to his question, the Reach Medical dollar is 87,860.
Oh, thank you, Frank.
Harmony texted me.
Across the ether. Yeah. I'd like to add that the opioid task
Oh, yeah.
money of $720,000 roughly has been going through the legislature's approval, and it will be approved at the next meeting. And Reach is one of the recipients as well. And I think there were 8 different contracts that we focused on that. And I imagine the money will start being awarded fairly soon after that.
Well, we had a deadline, has that deadline come gone? Has all the money been?
The deadline for submitting applications came and went. It took a while. I mean, we had bi-weekly meetings for months
Right.
and to set the parameters. And we had a lot of good applications. One of them was the United Soccer Club received some funds, a small amount of, but there, you should, it's way up online, I imagine, to look at that once it's approved.
Yeah, it's in the agenda packet for the legislature. It's really their decision, so we didn't make the recommendation public on our avenues. But once the legislature votes on the 19th, we have a press release ready to go, thanking the task force members, outlining everyone that got funding to really, tell the community what we're doing with those settlement funds.
Get in there, exciting.
Anything else? Okay, subcommittee updates. We have updates from the Developmental Disabilities Subcommittee and the Substance Use Subcommittee in our packets. So perhaps everybody could just peruse those when you have a moment. Larry, do you have an update from the Health Subcommittee?
I do, and I apologize. I didn't realize I was supposed to submit a written report. So I will make sure I do that next time. I'm also experiencing some weakness of my signal, so if you have difficulty, just let me know that you can't hear me. The sort of 3 things that I want to highlight that we've been working on. One is that we did an awful lot of work with Harmony on developing the state plan for mental health. That was a big part of the work we did. The other is that we have really, like the other subcommittees, spent an awful lot of time learning about and talking about the housing and homeless situation. And thirdly, and most importantly, I think one of the things we discovered sort of accidentally, or at least accidentally on my part, because I sort of assumed that this had happened. The ACT team, the assertive community team that is based in Ithaca. Some of you may remember that we have for a long time advocated for the service to be available countywide. And somehow in my mind, I had assumed that either A, when they moved to Ithaca, they sort of expanded the service to the rest of the county, or B, we're working on it. And it actually turns out that C is the case, which is they still don't cover significant parts of the county. So in the next year, I would like to really sort of find out why that is the case. And I mean, they said essentially that they really just don't have the staff or the cars to cover the entire county, but they do have the staff and the cars to cover, for instance, all of Schuyler County and some of the other areas that they serve. So I'm a little at loose ends about what our next steps could be, but we really need to have the ACT team cover the entire county. The subcommittee took July and August off, so our next meeting will be next Tuesday, not tomorrow, but the Tuesday after at 1, and we will be looking at the Children's Act team. I think that's what, and also looking at a really important issue, which is that the Surgeon General of the United States put out a report on loneliness as a public health crisis and a public health issue. So I think you'll be hearing some more about that as the subcommittee sort of looks at that and tries to think about what we can be doing to address loneliness as a topic. It might be a way to get people more generally interested or connected to mental health if we're talking about loneliness as a public health topic. So the subcommittee has been busy and we will continue to be busy. Any questions or things that other members of the subcommittee remember that I don't remember that we've worked on? And I will submit monthly reports going forward.
Thanks, Larry. Just a brief report in writing would be fine. I don't want people to have to spend too much time on it. Any questions for Larry? No, that's quite comprehensive. Thanks, Larry. Sounds like there's a lot going on. Okay.
No problem.
So we have guest presenters tonight. Deborah Barber, Sheriff's Deputy, and Rachel Webb, Clinical Therapist, are here to present a co-response model, Crisis Alternative Response and Engagement or CARE team. So welcome and thank you.
Thanks. So I'm doing the explaining or.
Well, let's Harmony, do you want to kind of give an introduction?
Well, I'm sure that they can go into a lot of the details. This was an initiative that we started a while back and got approval from the legislature for a co-response team between a sheriff's deputy and a mental health clinician. The idea really behind this model is there's really some pretty good evidence of its effectiveness in providing a better service to people in the community when they're experiencing a mental health crisis. And it's one of the few things that law enforcement can do when calls go through 911. And it's sometimes the situation, and I'm sure they'll speak to this, it's not even clear that it's a mental health crisis when the call is initiated. So this team can be activated in those kinds of situations. It could just be a well check or something like that. And then it's discovered that, boy, this person really could benefit from some supports for mental health. Law enforcement really can benefit from having these kinds of teams to respond to situations where people are calling 911 and needing that kind of assistance. They've been shown in research to result in fewer people getting arrested, having unnecessary emergency department visits and that sort of thing. And then the follow-up supports have been shown to really reduce suicide and to ensure that people follow through with some of the recommendations that they're given. So there's really fairly good support for these programs, along with CIT trained law enforcement officers. And I'm sure Deborah can speak to that a bit more. So we're excited to have this team launched. It's one of the really positive things. Law enforcement can partner with mental health to improve access to services. And I think we really believed when we started this model, when we were looking at it, that we're going to serve people that have never come to the attention of mental health services agencies previously. They're not picking up the phone to call 988. They're picking up the phone to call 911. And we need to make sure that's the best response possible. So I'll turn it over to you guys.
So we started taking calls about 2 weeks ago, almost 2 weeks ago. We're still learning as we're going because it's a new program. Not everything is worked out. But it's so far, I think it's been really good working as it was intended to work. Our very first call out was a 911 call of a gentleman who had said, "I'm going to kill myself." The state police had responded prior to us. Sometimes dispatch doesn't put us on the call right away. So we're kind of say like, "Hey, can we go out on that?" And they add us in on the call. But we spent about 2 hours with this person, and the state police would have done a 941. If you don't know what that is, just taken involuntarily to the hospital for an evaluation. But we actually prevented that. The follow-up call 2 days later, he was much better, and like we spent the time to prevent like the ambulance from staging for a really long time or having to take him, the hospital staff for the evaluation, the state police time. So we've had a few calls like that just within the last week and a half where we've prevented 941. So we do a lot of follow-up. I think it's been a good resource for the officers. Sometimes they come back from a call and they're like, "Hey, what do you think about this situation? Or is that something you should or can go out on?" And we oftentimes do. So we've had quite a few calls. Today was actually probably the most quiet day we've had in the last 2 weeks.
Oh, you just jinxed the heck out of it.
I know.
It's early in the week.
Naughty word.
Yeah, it's really exciting. We were super excited to get our first call. So, and I don't know, are there questions or what types of things do you want to know? Yes.
Well, particularly when you said that your team, 2 weeks old, get in there in 2 hours to have this seemingly good intervention, somebody who would anticipate that would have been a 941. Oh, what do you think the difference is? I can imagine what you're doing compared to what they would be doing to get it to a 941.
I think one of the biggest factors is that it takes a lot of time for people who are suicidal. That's not going to resolve very quickly. And I don't think that the law enforcement has the capacity to have officers tied up for a couple hours. Plus, they're quite not, like sometimes they're not sure about their judgment. They're not mental health professionals. They may know a lot about mental health and deal with it all day, every day. But I think it's easier for a clinician to tease out, like, I can safety plan with this person or feel out what needs to happen to prevent a hospitalization or an evaluation.
It's fair to say one of the issues, you got to be more patient. Most situations.
I don't think that's most of it. I think most officers are very patient. But they do have calls piling up that they have to go to as well. And also officers are not licensed clinicians, so they can't do the evaluation that Rachel can do. So their resources to take them to the hospital, to get them to someone that can do that evaluation.
So you're doing an evaluation right on the spot as you're talking.
Yep.
Different than a police.
Absolutely, yeah, because the police aren't qualified to do a complete evaluation, but Rachel is. So if she doesn't think that they're going to be admitted to the hospital, then there's no reason for the person to go. Whereas law enforcement, we don't know. Like if the person says they're going to kill themselves, we take them for their word to err on the side of caution because we can't say that they're not going to. So then that's when they get sent to the hospital for a 941 violation.
Yeah, we get the hospital list. So the people that we've come across that we've intervened with, nobody has ended up back in the hospital. In fact, there was one person we went out, she was calling the police several times, well, every day saying that somebody had stolen something. She had dementia and she was delusional, but it was related to dementia. And we went out and spent some time with her and she hasn't called back the police once. And that was a week ago, I would say.
Yeah. And that was like every day, multiple times a day, saying that someone had come in and broken.
Followed up with APS to make sure she had eyes on her and people were in there. They'd been doing a lot of work with her, which we didn't get when we met with her because she couldn't remember. But we do a lot of follow-ups with APS. I put SPO referrals in, contacted care management, just whatever we can bring in to get somebody stable. APS has been really great about responding quickly and if somebody they're not connected with, then they also go out and connect.
Can you describe that acronym for us, EPS?
Oh, Adult Protective Services.
Yeah, and law enforcement wouldn't necessarily know that she was involved with them because she couldn't communicate that. So it's nice to have Rachel be able to say, yeah, we can check and see, and then connect with the APS worker to say, hey, I think this person needs a little bit more attention. So that really helped.
Yes, I see a cluster of hands. I think Jessica, you had your hand up first.
Yes, I think this is wonderful and I'm so excited that it's launched. I have a handful of developmentally disabled teenagers who often end up being involved with police. Is there a way to instruct families if they do call 911 due to concerns to request the care team respond?
Yeah, they can absolutely request the response. There's certain criteria that dispatch has. So there's things that we're not allowed to go out on. If there's any sort of violence or weapons, then the deputies would go in and clear it first to make sure it's safe. And then we would come in after. So we would be staging close by. We've staged several calls now that we were able to help out on in the end. But yeah, they can absolutely ask dispatch for the care team.
As long as it's in our areas of jurisdiction, we don't respond to city calls right now because we're the only team. And so we do like whatever the sheriff's department responds to.
So Tompkins County outside of the city?
Outside the city of Ithaca.
Thank you.
I have two questions for you. I'm curious how dispatch makes the decision to include you or not include you and how that may shift over time. The example you gave with the state police arriving before you and then asking to go. Is this a function of not knowing that you're there or proximity and somebody's free and closer, or how's that all get shaken out?
I think the state troopers, I think that they're not quite acclimated because we've talked about this briefly when we've went to calls together, but we're actually going there this Wednesday to do a presentation with the sergeants with the state troopers so that they'll understand. And I think that we'll get called out more, and as confidence builds and it's getting used to, I think it's probably habit sometimes for dispatch just to call out somebody else, not remembering that we're there.
Sure.
Yeah, also, dispatch has a list on sheet 7. There's some examples of what calls they will send us out to without being secondary, but in certain situations, we would be secondary if it's like, so for example, the example that Rachel was given, that individual was very elevated and not making a lot of sense and just like, I'm gonna kill myself kind of. So that would be a situation where other officers would go first and make sure it was safe, and then we would go in and,
Gotcha.
you know, continue to calm the situation down or keep the situation de-escalated. What was the second part of your question about dispatch not knowing?
Well, it sounded like that was part of the,
Yes.
so new, they just may not be as
Yeah,
aware.
They do have a list. There is a policy, so they do have the policy in front of them knowing, but then there's always a gray area, like, do we send the care team? Do we not send the care team? So for example, this afternoon, we were assigned a call that wasn't really a care team call, but we went with it anyway because, you know, involved a juvenile, maybe having a weapon, and it wasn't something that we had to respond to, but it was something that, you know, if we could prevent a crisis, then that's what we're supposed to do. So we
Well,
we
it gives
went
you
with it anyway.
an ambassador for mental health.
Yeah. Yep.
I want to echo what was said before too. I just absolutely, I'm so happy that this is happening. It's well needed. My second question was about the follow-ups. It sounds like within a short period, there's a follow-up, and I wondered if there was any additional follow-up, or are you limiting that to make sure you don't wind up doing too much case management? Like
Yeah, we've only
your
done-
resources are going to be limited. So I'm curious how that sorts out.
We've only done one follow-up just to tie up loose ends. If somebody needed more than one follow-up, I think that if we had time, we'd absolutely do it. We don't want to be the ongoing person. So it's really just about making sure that connection happened and that they're still stable and seeing if they need anything else.
Thank you.
So, you know, that a lot of the people we've run across, they have actually said to us, like, this is really cool. Like, thank you for what you're doing. We really
Yeah.
appreciate it. Like the people that we've gone out on. So that was pretty neat.
And it's nice for me to see people not in crisis, because 18 years of my career, I've seen people in crisis. So it's nice to go and respond and do the follow-ups to see people that aren't in crisis and to be able to talk to them and, you know, make that connection. And a lot of the follow-ups that we've done already are self-initiated. We have, when officers say, hey, this person, like the one lady with dementia, that was our own to go over there and talk to her. That was our own thing. And there's been a couple more where the officers say, hey, you know, put this person on your radar. They might need you just to, and I'll reach out and say, hey, I heard that you had a crisis the other day and, you know, we weren't available. Can we come out and talk to you? And so that's helpful too. And then after, you know, we've been involved with certain situations and we ask, hey, can we check up and see how you're doing, you know, in a couple days? And there's been a couple that, you know, we were able to do that. There's actually been 2 times so far, and this is really exciting to me, that we prevented the person from going to the hospital. And that's great because we just gave them the care that they needed right there. And a lot of times the hospital can be traumatizing to people, like that whole situation. They want help, but they don't want to go to the hospital because usually there is no reason to really admit them. They want to talk to someone. I think like Larry said about the loneliness thing, there's a lot of people that are lonely out there, and that's what brings them into crisis. So. Randy, did you have your hand up?
Yeah, Travis asked one of the questions.
Oh, you did? Okay.
It's good to hear that the legislation, something, right? So you guys, are you both in the same office area, or how do you communicate that process?
Yeah, we don't actually have an office, so there's multiple computers at the sheriff's department we use, but we're in the car a lot of the time together.
We have a
Already
mobile
on the road,
office.
ready to go.
Space is pretty
Yeah.
tight up there.
Yes, it is. Yeah.
Flexible and responsive.
Yes, yeah, so we have, so on page 9 of the presentation that Harmony made. There's a vehicle that I'm not driving right now because it's in the repair shop for the second time, nothing that I did. But that's our vehicle and we spend a lot of time in the vehicle, so we're out and about. Well, like if we have had interaction with someone, we do like a drive-by just to see, you know, what's going on and making sure that, you know, things are, we don't go in with like, for the one person, for example, his mom, he had his mom for support. So one day we went by and we saw her car there. Oh, great, his mom's there. He should be doing well, you know, just if we have downtime, but Yeah, we stay in the car, so we're more mobile. If someone calls and, you know, if we get a call that says, you don't care, can you respond to that? Yeah, we're already out and about and we go. And so that's our office, mobile office. There's a computer in there where I can keep track of the calls and do reports and such. So it's pretty exciting.
Monday through Friday, 8 to 5.
9 to 5, Monday through Friday. Yeah. They're hoping to add more teams, but we don't have the people right now.
I know that your team is very new, but have you, or do you anticipate getting any interest from the City of Ithaca Police or?
I'll answer that, 'cause I don't, but I'll answer that for you. So the OTR that was originally approved by the legislature created one sheriff's deputy position and 2 social workers with the expectation that the second social worker would team up with an IPD officer. We haven't been able to recruit that second social worker yet. We're so thankful to have Rachel so we could get the sheriff side up. So the plan as the process kind of unfolded was to, in this pilot, have a team in the city and a team at the sheriff doing the rest of the county. One, we haven't been able to recruit the social worker, and 2, obviously there's a lot going on with IPD in the city right now. We've talked with the mayor and the chief of staff, and they are on board with trying to find a solution. And they are committed, as they've communicated to us, that if we have a social worker, that they will work with us to figure out a way to get them partnered up. It may not be like this scenario where it's the same law enforcement officer all the time. It may just be a rotation of whoever's on duty. But they are very much interested in participating. In the meantime, our mobile crisis team as it exists is still responding and supporting the city of Ithaca, instead the city of IPD, the city of Ithaca. So our social workers on staff are still going to be helping. We are really trying to get away from that by the end of this calendar year because it's eating away at our clinic and putting enormous amounts of stress and pressure on our senior clinicians who are doing most of the mobile crisis team coverage during the daytime hours. So if and when we get that social worker hired, our intention is to, best case scenario, be able to partner them up with a law enforcement officer. If that isn't able to happen for some reason, that person would then be the kind of mobile crisis person for the city of Ithaca during the daytime hours instead of our clinicians.
Right.
So we are committed to continuing to cover the city of Ithaca. And as soon as we can get that social worker hired, we'll start to see a similar model evolve with that.
Yeah.
Frank, what's the salary for that position?
I don't know what Harmony, do you know what the salary is for our licensed clinical therapist?
I'll find it for you. Hold on.
Thank you, Harmony.
Travis, did you have your hand up?
Well, I know it's probably way too early to know this, but I'm curious, as services are delivered, I'm sure that people are very grateful for the mental health support, but I'm curious, do you get any shift in the perception of police? Yeah, it may be too early to know, but I'm hopeful that they may see you as a help instead of
I think,
just a heavy.
well, personally, whenever I respond, I get seen as more helpful.
Well played. Well played.
Yeah, I can't speak for all law enforcement, but I think though, yeah, it's nice to have, like I was saying before, to see people not in crisis afterwards anyway. So I think that would help too, is because then they can see law enforcement when they're not in crisis as well. Because as you know, when people are in crisis, everything's heightened usually. And so, it's fight response.
I can say that being a social worker going into the sheriff's department, they've been really welcoming and wonderful. There's a lot of people that are like, we're so glad you're here. Thank you. They've been great.
I'm curious, and I'm not sure who to direct this question to. Was the idea to start the care team between the hours of 9 a.m. and 5 p.m. a database decision? Okay.
It was based off of the call volumes that we were seeing for the mobile crisis team. Obviously, we would like to go and cover a longer period of time. Our original request was for 6 teams. And that would have covered from, morning till 2, 3 in the morning, I guess, first and second shift, which would have covered almost all of the calls. But that's extremely expensive. And we wanted to be able to have some data that shows that the teams are having a positive impact. So that's where we are right now. We are in the process, speaking of data, we are in the process of developing the data collection points with the sheriff's office and the community justice center. So that way we're able to report out, not just anecdotally the stories that Rachel and Deputy Berber are talking about, but to be able to show data. It should not be understated. Diverting somebody from going to the hospital is a giant victory, right? On so many levels, whether it's the individual and their experience, all the way down to the cost to the rest of us, right? That goes along with it. So we've got to be able to tell that story with data, and we're going to be looking to try to do that here.
Do you have an independent evaluator?
I think the CJC is kind of that. We don't have we haven't identified one formally. Harmony, have we, that I'm not aware of?
No, we don't have an independent person beyond the CJC, but that may be down the road, something to look at, because the data is really going to be important.
Yeah.
What's the difference between the crisis team and the care team? Aren't they escorted by police as well?
So the mobile crisis team as it exists is an on-call service. So our staff are doing their daily job and then they're getting called away for mobile crisising, which means they're not going on scene very often, right? They're serving as kind of a triage function, working with law enforcement, offering the ability to do a 945 for the officer if they need it for a transport. But as you can imagine, that isn't providing the same level of service as having Rachel, out there in the fields with, a law enforcement partner. So that's the difference. When we developed this way back when we launched Mobile Crisis Team, we were expecting 1 to 3 calls a week. We're getting that in a day now. And so that can't be covered with on-call people that are working during the day. We're still going to cover the evening hours when these folks aren't working with our on-call system to be able to still support law enforcement until we can hopefully prove that we need to have more hours covered. But during the daytime is where it really negatively impacts the clinic, because those folks have a full-time job in the clinic and they're being pulled away to do these crises, which impacts them. It impacts the clients they're trying to serve in the clinic. And we've really come to a crossroads where we can't do both. We either have to focus on the clinic and let them do that work, or we have to focus on mobile crisis, which means we're going to see less people in the clinic.
Right. Sounds like more that. And the funding stream, where's the money come from?
Right now, it's all county funded.
Yeah, okay.
And the salary is $84,468.
Thank you, Harmony.
I was just gonna ask, ignoring the people behind me. I was gonna ask, as part of the response by the care team, as part of the stabilization process, linking people to services and resources.
Absolutely. That's a big part of it. Yep.
One of the things that the counties recognize is that response times in general have been really slow throughout the county. For EMT services and so their service is focused on reducing the number of people who have to go to the hospital, and so to help lower that. The county is looking at this year's budget to fund basically EMTs or emergency response people that won't do transport. So that's going to be a budget discussion this year because in a lot of cases, it's taking a half hour just for somebody to be there to provide medical help. And I'm sure education on mental health is going to be a big part of that as well. So I think that there will be a big budget request for that this year. I don't know the details, but that's what I heard.
Questions? Any questions online? Okay, great. Well, thank you so much. Yeah, that's great.
Thank you.
Hey,
Thank you.
should we leave?
You are free to go.
Get some rest.
Go now.
You're gonna be busy tomorrow. 'cause Rachel-
Yes, Rachel jinxed it. I guess so.
Thank you both.
Thank you. Yes, thank you. All right, so any other agenda items before we go into executive session?
And I just wonder if you want to give our guests any time to talk about their interest in the board.
Sure.
Okay, yeah, we'll just start. So as I mentioned, Nicole Zulu here, as the director of the Tompkins Health Planning Council, which serves as the Rural Health Network for Tompkins County. We're really trying to make an effort as an advisory board to really link more of mental health, substance use and disability services into the work that we're doing. We certainly have representation, Jan being one of them on our advisory board. But we're just really trying to make a lot more of our work plan and work. So that's why I thought this would be a great linkage between the two. And I will say personally, my background, I have a MSW and a Master's of Administration and a PhD in health policy focusing on access to care. So I have a real passion for especially mental health services. So I've been really having a lot of conversations within the community to really put forward this work in our work through the Health Planning Council. So that's what brought me here and interest in joining this board.
Sorry, and your name?
Nicole Zulu.
You next. So I'm Howard Reed again, and my wife and I moved with about a little over 4 years ago. My wife is an Ithaca native, and she wanted to come back home and be with her parents in their later years. And that we moved to Ithaca from Connecticut. In Connecticut, I was the director of a mental health system in one part of the state of Connecticut. It was a mental health center called River Valley Services. It encompassed basically a managed service system for mental health services. So it was both the mental health center and then a system of contracted services, which was fairly large and pretty well funded. And so, you know, that was my career there. And I retired and then was able to, of course, move to Ithaca with my wife, but continued to be very interested in mental health and have been following the developments here in Ithaca for these COVID years, and certainly appreciating the difficulty of operating during COVID, but also excited about things like this care team, because this I think is a very important initiative. The focus on housing and homelessness that spans a number of these areas is also something that has been of significant interest to me, and I think Ithaca is sort of poised to make some progress with that in a way that could be extremely valuable. So anyway, I do have a lot of experience in areas that the community is dealing with right now, and hope that, you know, perhaps I could be of some help as you undertake this period in which there are a lot of really important things happening and a lot of important issues to try to address.
Wonderful, thank you. Hi, I'm Anna Demas. Similarly, I have just been here for 3 years during COVID. And as a parent of 3 school-age children and as a clinical psychologist, over these COVID years, I've just become increasingly concerned about access to care for primarily youth and adolescents in particular. So I'm really here to learn more about the community, to see these absolutely wonderful efforts that are in progress. This is just so exciting for the work that I do. I have over 25 years of experience as a psychologist in the state of California. So I'm definitely still learning the lay of the land, but I started out my career as a teacher. So I have definitely that educational lens to offer, as well as the lens of a clinical psychologist here in this community where there's so many progressive, wonderful things in progress. So I just really would like to lend my support and any efforts I can towards advocating more for additional services.
Great. Thank you so much. Do we have any other guests online?
Khaki, please.
Oh, Khaki. You're muted, Khaki.
Khaki.
You're still muted.
Muted, Khaki.
Ah,
There you go.
thank you. I'm Kaki Wunderlich. As I noted, I'd previously been a member of the board. I had to leave a couple of years ago because life just became too difficult. That is better now. And I'm particularly interested in the relationship of mental health and other disability related issues, particularly in terms of youth and also seniors. I do now work a seasonal job running the tax program at Lifelong, so I've gained a lot more experience about what the reality is for our seniors in this community, as well as recognizing a lot of, to be honest, mental health issues, including loneliness. I'm so excited, Larry, that the subcommittee is going to take that on and seeing that. One side piece I want to note, the position that Randy was talking about, I also sit on the Youth Services Board. The position that Randy was talking about that right now is in the soft freeze and it's gone in as an OTR. One of the reasons I'm particularly concerned about that position is that it will be the first position in that department who is specifically has written in their job description to provide technical assistance to youth programming, whether it's camps or county sponsored programs or any others related to inclusion for youth with disabilities and mental health concerns. And so it's really important that we as a community have that position put back in. Last thing I want to say about board issue here is my understanding is that there are 3 positions that you're looking for on the board. If that's the case, I see 3 other strong candidates. Those of you who know me know that diversity is one of my big issues, and part of diversity on a board, I believe, is new blood and new ideas and new experiences. So what I would say to the board is I'm interested. I'm plan to continue to be attending as a community member, but if you have enough other good members for the board, I'm perfectly happy to hold my request to rejoin the board until perhaps there's another position that's open.
Great, thank you, Kaki. And I'll just jump on there and concur with what you said about the technical assistance for youth services in Tompkins County in relation to disability access. It's a critical need in the county. Kids with disabilities do not have equal access to programming, camps, childcare, et cetera, despite the legal obligations of childcare programming in the county, because they don't understand their obligations. It's something that we were working on for a long time on developmental disabilities subcommittee. So just wanted to add my thoughts to that. Okay, anything else before we go into executive session? All right, well, thank you so much, Jess. It was so nice meeting you.
Thank you for coming in.
Thanks everyone online, guest wise. Jan, Larry, don't go anywhere. Harmony, you too.
Take care. Thanks for coming.
How do I leave?
In the bottom right.
I don't see how to. Oh, there we go.
Says leave.
Bye.
Oh, maybe, I don't know, maybe not.
Were they all board applicants? I thought some were just subcommittee.
No, they're all board applicants.
Okay.
We don't,
Yes.
and we don't.
And
No.
oh, are we,
Is Susie still on the board, right?
Yeah, yes.
Yeah. Okay. So then we do have quorum. Well, no, we don't, they're not.
No,
They're not. I don't think, we've done.
I'm sorry, I was just gonna say, I'm very confused about the status of public meetings law, and we don't have to talk about that now. I know they were going to change it so that it was, if you were online because of a disability accommodation, you could count in quorum, but I'm not sure if that change has been officially made yet.
Jan's been asking about that. I have put in a request to the clerk of the legislature to get some clarity on that. But I've not been given any different guidance related to in-person quorum requirements.
Okay.
I suggest that we go into executive session.
Okay.
Larry had his hand.
And Larry, well, all right, we're officially.
Wanted to go into executive session. And just before I stop everything, we're going to the executive session to talk about a particular individual. Okay. Let me stop just give me 1 second before anyone. I gotta remember what I'm doing here. Scare me for a second. And that.